the Gulf States newsroom, this is the Gulf States Gumbo, your weekly serving of stories from Alabama, Mississippi, and Louisiana. I'm public health reporter Drew Hawkins, chopping it up this week.
Streekvervoer en trein.
So back in March, I hopped on an international flight and I went to the Netherlands. I stayed in Amsterdam, I took trains and subways and, of course, bikes to get all around the country. But this wasn't a vacation. The reason I was there was to find out how the Dutch approach to drugs works and how it's different from our own. And one of the biggest differences is their focus on reducing the harm of using drugs. So I took the metro and I only got lost once or twice, and I headed over to Amsterdam Centrum, the city center, to meet with a harm reduction organization.
Deze metro gaat richting...
Like with driving a car. Who sees great ways of harm reduction in driving a car?
You can just tell Haas Cornelissen used to be a high school physics teacher.
Driver's license?
The driving license. I love the driving license.
He's guiding his staff at Mainline, a harm reduction organization in the Netherlands, through a safe injection training. They're learning how to correctly prepare and inject opioids like heroin and fentanyl.
Yes, just prepare your shots.
The goal isn't to promote drug use. It's to reduce the harm of using drugs. The Netherlands averages around 300 overdose deaths a year. There were more than 80,000 in the U.S. last year. Haas says the Dutch don't embrace harm reduction because they're more tolerant or open to people using drugs. It's because it works. Again, the physics teacher comes out.
Do you believe in gravity? It's a hilarious question for that reason. Same goes for harm reduction. It has been proven so many times. So how can you doubt it?
Mainline offers services like syringe exchange and drug checking, and part of the organization's mission is to connect with people who use drugs.
The most thing I think they need is someone to listen to them.
Sultan Baghdadi is an outreach worker with Mainline. We're outside a safe consumption room in Amsterdam. It's a place where people can use drugs under the supervision of medical staff. Inside are a handful of people scattered around tables, some using cocaine, others, like Lucas, injecting heroin.
I wonder if you could just tell me a little bit about how this space works.
You have to register downstairs and...
Sultan hands out brochures about the risks of synthetic opioids like fentanyl, and he sits with people and just talks with them. If they want help or treatment, he can connect them. Research shows harm reduction helps prevent people who use drugs from getting sick and dying. But in the U.S., it faces a lot of pushback, with some saying it promotes drug use.
To these people, I don't need, if I talk to them, I don't need the words harm reduction, because they hate harm reduction. It's woke.
Dr. Wim van den Brink is a professor of addiction psychiatry at the University of Amsterdam. He's been researching and treating addiction for decades. He's also chairman of the board at Mainline, which gets both city and national funding to support their work. Van den Brink says harm reduction shouldn't be a political issue.
I don't call it harm reduction to these people. I call it care. I present a medical model.
One region in the U.S. where harm reduction faces a lot of resistance is the Gulf South. There are no official syringe exchange programs in Mississippi or Alabama. They're actually not legal. In Louisiana, there are only a few. One of them is the New Orleans Syringe Access Program, or NOSAP.
This is very much the drop-in area.
Caitlin Boyle is prevention manager at NOSAP. The drop-in area is reminiscent of places in the Netherlands. There's people waiting to get syringes, supplies like drug testing strips and naloxone, or Narcan, to help prevent overdose deaths. Boyle says just a few years ago, a place like NOSAP couldn't exist in a state like Louisiana.
Harm reduction is a deeply politicized thing, but the opioid epidemic isn't.
NOSAP is part of a community health center called Crescent Care. Boyle says that designation gives them what she calls an institutional shield, because in Louisiana, harm reduction isn't just political. It can sometimes be dangerous.
The criminalization is so active that providing this care, providing harm reduction services, is a risk.
NOSAP relies heavily on federal grants, and with the Trump administration's budget cuts, they're worried they won't be able to continue doing their work. They've started stockpiling supplies, filling cabinets and closets with boxes of syringes.
We're kind of prepping for the worst case scenario right now, just in terms of funding.
NOSAP will get some opioid settlement funds. That's money from lawsuits with opioid manufacturers and distributors. But if the cuts to the federal funding that trickle down to them goes away, Boyle says the impacts would be devastating.
That's the main concern, is like death and losing our people.
The opioid crisis has shown signs of improvement, with overdose deaths finally starting to drop, thanks in part to harm reduction. But it still struggles to gain support.
The Gulf States Newsroom is a team of journalists working with NPR and local public media stations in Alabama, Mississippi, and Louisiana to cover the issues that matter to you. Email us, connect@gulfstatesnewsroom.org.
You're listening to the Gulf States Gumbo. I'm Drew Hawkins. And you just heard how the Dutch came to embrace harm reduction after the country's heroin crisis. And while I was in the Netherlands, I also really wanted to learn how the police fit into this approach. And to get a street-level view, I went to some of the most famous streets in the world, in Amsterdam's red light district.
So that can be paracetamol. If you say it's drugs, we
Which one was using drugs? This one?
This one.
So this
Openlijk gebruik.
Dutch police officer Bob Blankenzee is showing me his citation booklet, explaining what happens if someone is caught using drugs on the street instead of a place like a safe consumption room where it's allowed. In Amsterdam, it's considered a public nuisance, same as alcohol.
Is this like a ticket or like a summons?
No, this is from the government.
Okay.
And we can this is a restriction for 24 hours of this area.
We're in Amsterdam's famous red light district. Bob is out on a daytime patrol. And with us is Mo Bakayan, a social worker with the city's health department known as the GGD. Mo uses his lived experience as a former addict to connect with people.
I'm not somebody who went to school and get a lot of certificates and education and to tell people what to do or how to. I tell them only what I experienced and how I dealt with it.
Dutch police work hand in hand with the health department. It's an approach that started during the country's heroin crisis in the 1980s and early 90s. While on patrol, we stop at safe consumption rooms and shelters. Bob waits outside while Mo checks in on people, like Alvin Miedeman.
This is basic coke pipe, crack.
Crack pipe. But who said that is crack pipe? That is one pipe. I can also smoke hashish and of marijuana inside.
Alvin is originally from Curaçao, a former Dutch colony. He was living on the street and recently had a foot amputated because of his drug use. And he's got lung cancer. Mo helped him get a room at the shelter.
But now I'm here, and it's okay.
The red light district is calm and quiet during the day. By night, it's a whole different world. I'm following Bob as he patrols the area in plain clothes. His main targets are pickpockets, but we also come across a few people using drugs, like this man, smoking base coke, or crack as it's known in the U.S. Bob gives the man a 24-hour ban from the area. He says he knows in the U.S. he could have arrested him.
And here we try to manage it by light penalties and offer him then help. What do you need to get rid of this situation?
During the Dutch heroin crisis, the red light district looked a lot like parts of the U.S., cities like Portland or Los Angeles, with open drug use and people sleeping on the streets.
It was a little hopeless situation.
Margot Cohenraads is with the Netherlands National Narcotics Police in The Hague.
And then some clever people thought, maybe we should do it in a different way.
That different way also includes harm reduction and treatment with medication for people who use drugs, including in prisons and jails. And the police focus on drug trafficking and production.
So in the Netherlands, we don't have a heroin problem anymore.
The Dutch system isn't perfect. Several people talked about harassment from police. And there are huge differences between what police in the Netherlands and police in the U.S. have to deal with.
We're not like the Netherlands, right? The Netherlands are the Netherlands.
Juan Cloy is chief of the police department in Macomb, Mississippi, a state where even a first-time drug possession charge can land you years in prison. Cloy says after locking people up as a street-level narcotics officer in Jackson, Mississippi, his views on drug laws changed.
It hasn't worked. All it does is take people from their family and friends.
Now as a police chief, he stopped arresting people for low-level drug offenses like possession because he wants people to feel like they can call for help if they need it. Cloy says drug use is a public health issue, not a criminal justice one. But he says the way American culture views drugs is tough to change.
As long as we have a culture of separation, it's not me that's hurt, it's you attitude, then we're going to always have opioid epidemics, and it's still going to fall on law enforcement.
Across the country, more than 1 million people are arrested for drugs each year, and so far, it hasn't put an end to the opioid crisis. While I was traveling, it was also carnival season in New Orleans, and it turns out, also in the Netherlands. So instead of a Gulf States gem, I've got a Netherlands gem with Dutch Carnaval. It's Sunday morning in the small village of Slijk, about an hour's drive by car outside of Amsterdam. From now until Tuesday, everybody is focused on Carnaval. Josje and her husband Jos Cornelsen are busy getting ready for a day of parades and singing in the choir she started.
And I started that choir 23 years ago because nobody wanted me to sing with.
The town changes its name to Moesland after the region's famous kale, and the mayor steps back and hands the keys to the city to the Prince of Moesland. But this year, they've chosen a princess for the first time ever. 31-year-old Nicole Loeffler, Princess Nicole I.
Were you surprised when they announced that it was a princess?
Yes, of course, but every year you are surprised who it is.
In the last float rides Princess Nicole I, with a brass band playing to announce her arrival. Former Prince Joop Manders says he welcomes the change in royalty.
And now, this year, first time in Moesland.
And it's in good hands.
Yeah, really, it really is.
After the children's parade is finished, it's time to head into a giant tent built specially for Carnaval. Inside, the villagers grab beers and take seats around wooden tables. And they sing. The celebrations will continue on into the night, and then they'll get up and do it again tomorrow. More parades, more singing, more Carnaval. For the Gulf States Newsroom, I'm Drew Hawkins in Moesland. This week's show is cooked up by the Gulf States Newsroom team. Our theme music is by DJ Supreme. Special thanks to our partner stations, WBHM, Mississippi Public Broadcasting, WWNO, and WRKF. You can find us in your podcast feeds every Friday. Look us up and be sure to subscribe. Again, I'm your host, Drew Hawkins. Thanks for listening, and don't forget to stir your roux.